foreign body is an object or piece of extraneous matter that has entered the body by accident. There are two types of foreign body of the nose. The first one is foreign body of external nose, which is common in adult, for example, fillers such as silicone and hyaluronic acid. The first picture shows nasal silicone implant protruding through the nasal skin, and then the second picture is a keloid formation around the nose piercing. Next is the foreign body in the nose, which mostly seen in children. Some of the etiology of foreign body in the nose are pieces of paper, chalk, button, pebbles, seeds, and cotton. The first picture shows an endoscopic view of a right nasal button battery foreign body, and the second picture shows a plan X-ray of a right nasal button battery foreign body. Another example, a marble nasal foreign body in pediatric patients stuck in a child's nose, and then the second one is a button battery in the right floor of nose causing electrical burn with necrosis of the inferior turbinate and septum.
What are the clinical features? Patients usually present immediately. They will complain of unilateral nasal discharge, which is foul-smelling and blood-stained. We must remember that when a child presented with unilateral nasal discharge and the discharge is foul-smelling, we must exclude foreign body in the nose.
Next, let us move to the next part, which is the treatment. We can use a nasal endoscope, specifically the rigid nasal endoscope, to locate it. Hence, we can carefully remove it. If it is a piece of cotton or paper, we can use the Tilly forceps. If it's a rounded or hard in nature foreign bodies like beads, we can use the blunt hook. In order to have a static position, it is important to give a general anesthesia with cuff endotracheal tube.
Next part will be about complications of foreign body in nose. One of the complications is sinusitis. Nasal foreign body can cause local inflammation and swelling. This swelling can obstruct the sinus drainage and leads to sinusitis. Second will be nasal septum perforation. Some foreign body can be particularly destructive. For example, button batteries and magnets. Direct leakage from these foreign bodies cause corrosive damage, may rapidly induce ulceration and liquefaction necrosis, leading to septal perforation. Apart from that, extension into adjacent structures can result in other complications such as acute otitis media, periorbital cellulitis, meningitis, respiratory arrest when object becomes displaced posteriorly, and rhinology, which is an firmly impacted and unrecognized mineralized foreign body typically found on the floor of nasal cavity.